We are here with Dr.
Humera.
See, I knew I was going to say it wrong. I got it right 3 times out of 4.
Right.
Shah, but Dr. Shah, and you are a dentist, and you were a general dentist, but now you specialize in working with children?
I'm a general dentist.
Okay.
But ever since I graduated, I've been very lucky to work only with kids.
Okay.
I haven't looked in an adult mouth for like last 10 or 11
Lucky
years.
you.
Yes, to do that.
I consider myself very, very lucky for that.
And we've got a lot of different things that we're going to talk about with you, not the least of which is the fact that you are the author of this new book, Sam and the Sugar Bug, and we're going to be talking about that. But we want to start by asking you, what are some quick tips that parents can really get their arms around that will help to make a trip to the dentist be a little bit less frightening for a child who has special needs?
That is a very good question.
Good, I'm glad.
Yes. The most important thing is to get an early start. The first checkup of your child should be at his first or her first birthday, right after that. And after that, you're going to do it every 6 months.
Okay.
What that really does is, first of all, it familiarizes the child with the office and the dentist. He's going to, when he goes there over and over again, he's going to be more comfortable there.
Okay.
Yeah, it's a happy place for them, a fun place to visit. I know for my son it is.
Yes,
Yeah.
yes. Also, when you're taking them every 6 months, it becomes a routine. Routine is very important for a special need kid.
Of course.
And also, another thing that comes out of this is, let's say you went to a dentist at the age of 1, you didn't like the dentist, right? You have a lot of time to, every time go and see which is the right one. That'll give you more time.
Okay.
Also, if you're just taking a child to a dentist when he or she is in pain, think about it. Like you have a 5-year-old child or 6-year-old child, never taken him to dentist, right? Suddenly he's in pain and goes, "Mom, my tooth hurts, let's go." So you're taking him. That is inevitably going to follow with treatment.
Right.
Obviously, he's not hurting for nothing.
No,
right?
he'll associate it with a very negative experience as opposed to a positive experience.
If he's in pain, the least he's going to need a filling or an extraction or a crown or one of the treatments. It's not a very exciting thing for a first visit.
Right.
Right? So that is going to leave a sour taste in his mouth. And he may not get over the fear ever. So you never want to do that. First birthday, early start, and often every 6 months.
Okay.
It might surprise you that patients that I've had from their early childhood, some of the parents bring them to me every 3 months, just so they don't forget.
Right.
And, obviously special needs, like I said, it is not easy for any child, leave apart special needs. Dentistry is not circus. How much ever we sugarcoat is going to dentist, even I'm scared when I go. Obviously, you're having a person sitting around on your head, you have them obviously giving anesthesia, so it's really not fun. We can make it better for them, obviously. So the thing to remember, early start and often, as often as 6 months.
Well, let's take a break and we'll come back and find out about
I want to hear more about this wonderful book, Sam and the Sugar Bug, but I want to make sure that everybody knows how they can get it, because we have some copies of this book to give away, but you have free copies of it that they can get on the iPads,
yes.
correct?
Sam and the Sugar Bug was a print, but then I made it available on iBooks just because I realized how much kids nowadays are relying on technology. iPad has become a leading tool for kids, especially with special needs.
There we go.
So,
especially those with autism.
yes.
And it's free. We love free.
Yes, I have made it free from last 6 months, and I will continue to keep it free for a couple of months more.
Okay.
So I want you guys to download it. Very easy to download on your App Store. App Store is always on the screen. Search for iBooks. iBooks is a free app. It's Apple's library.
Right.
It's where you can download a ton of books. Some paid, some free.
Yes.
So once you download iBooks, go to the store and search for Sam and the Sugar Bug. It will open up the page. It will say free. Click on it, put in the password, you'll have the book free for life.
And we did that this morning, and so that's actually what you saw is our copy up here on our iPad, so easy enough to do. All right, we're going to take a break, and we're going to come back and talk more about Sam and the Sugar Bug and some other things that parents need to know, like how do you choose whether to do have the child put completely to sleep or give them just mild sedation. So all of that and more, stick with us. welcome back to Let's Talk
Thank
Autism
you.
with Shannon and Nancy. With us in the studio right now, we're having a really good time talking with Dr. Shah. She is a dentist, and we've been getting some advice from her about how to get our kids who have special needs to the dentist and have them not be frightened. And we've been looking through her book, Sam and the Sugar Bug, and we're loving it.
Yeah, we've got Evil Randy is a great character in here. That he has to get kicked out of Sam's mouth, and all his friends have been invited into Sam's mouth. And I know my son loves hard copy books. So Dr. Shah has been kind enough to bring us about 20 copies of these. So if you would like, write us here at Autism Live, and we can send these out to you. First come, first serve, right?
Absolutely.
But
and
you can
if
get it free.
Prefer to, like, I love it that your child prefers the hard book.
Yeah.
My son prefers to use his iPad.
Right.
And if your child is like that, you can get it for free. You can download it. And the doctor was just telling us, go to iBooks and then look for Sam and the Sugar Bug. So, and it's free right now. So tell us, so you're a dentist and you're working with kids. How did this book come about?
Well, like I said, I've been very, very lucky and fortunate to work with kids ever since I graduated. So it's not very easy to get a child to walk into a dentist's office, have him sit on the chair and navigate his mouth. It's pretty challenging for every child.
Right.
So I over the years, I realized that when I was looking in their mouth, I would tell them, oh, I'm looking at the bugs. Look, I see one bug. And they would let me do it.
Yeah.
And when I was like, oh, how many do you see? How many? And, because... And then I realized, oh my God, you have to come down to their level.
Yeah, you made it visual. You made it a conceptual thing they could understand.
With kids, you have to come down to their level.
Of course.
Otherwise, you will not get to them. And then the most common question that I always had with the parents was, how can I get him to brush?
Yes.
Or her to brush?
Yeah.
That is like the question I hear every day.
And then the one after that is, how do I get them to floss?
Yes, exactly. So these were my two inspirations. So once, I realized that, and then I was like, okay, I can put it together. Not only will it help me, because as you go through Sam and the Sugar Bug, it also explains the treatment, right? And it has the sound of the drill, which familiarizes in the end when it says, I'm going to clean out the sugar bugs.
Right.
Kelly added the sound of Kelly Flitzer is the narrator and the sound effects, who did an amazing job, and of course the illustrator who made it come to life, Javier Gonzalez. The sound of the drill, when they hear it and they go to office, and when you're fixing their teeth, they already are kind of familiar to it.
So clever. And we actually have a video from your website of the book. Emily, can we show that right now? This is Sam and the Sugar Bug.
Sam and the Sugar Bug by Dr. Shah. Layla had been taking good care of her teeth. She would always brush her teeth in the morning and at night before going to bed. Layla's brother Sam would sometimes get lazy and would forget to brush his teeth, especially at night. One night, Sam had dinner and went to sleep without brushing his teeth. Randy, the evil sugar bug, was looking for food and was very hungry. Randy snuck into Layla's room and found nothing. Randy went from room to room looking for food until at last he entered Sam's room.
I smell food,
said Randy with an evil grin. Evil Randy followed the scent, and it led him to Sam's mouth. Randy jumped into Sam's mouth and said,
Really fun.
We were just talking with Dr. Shah about this passion of yours the fact that you actually wrote this book, had it designed and, the illustrations, then put it into an ebook, had the narration done, you've offered this for free. This is really a passion of yours.
Yes, working with kids and making things easy for them. is my passion.
And when I
I
asked
get
you,
excited about it.
when I asked you if you had anybody with special needs in your family, you said my patients are my family.
Yes, the fact is I don't have any special need child in my family, but every day I see a ton of them. So they become a part of my life.
It's really remarkable.
So sweet.
I see all the kids, but because whenever you have a children's office, most of the adults won't see them, which I would never recommend any child to go to an adult setup. So
Right.
most of the special need come to be a
Yes.
children's office.
Right.
Really remarkable. And you had mentioned before that that there are ways that the book can help a child to be able to brush. And I know I'm always concerned about, I can get my child to brush, but I'm concerned about, is he brushing effectively? So what advice, I know you've got a
Model
visual
there.
aid over
Yeah.
there. Help us.
Yes, it looks kind of ugly because of my work when back in the days when I was a student and I had to practice. So kind of found this and it looks like funny, but I think we can have
It's okay.
we
It's
can
all right.
go ahead. The most important things with the kid to brush is I really want the parents to do it when they are
Okay.
young.
They're young.
Well, first of all, age 1 to 3, you have no choice but to
Right.
brush
Yes,
yourself.
of course they don't really.
When you go on from 3, let them do it, but you got to tell them, look, there's Randy in there, there are bugs in there. I think they're hiding somewhere. Oh, I see there one. I got to clean it.
So make it fun.
Yeah, make
Yeah.
it fun. Make it fun. So important thing to remember is you need not only to brush the teeth, but the gums too.
Yeah.
Okay? So make circular motions. See how I'm getting the gums too? Because if you're just brushing teeth and skipping the gums, the bacteria collect along the gums. They will cause the infection of the gums, which is, of course, called gingivitis.
Yes.
The plaque will accumulate, and which eventually will lead to cavities too, apart from the gum disease.
Okay.
Okay.
So every time you brush, make circular motions, go around on the gums, in the back, and very important, inside, towards the tongue in the back is pretty challenging.
Okay.
So make sure you're doing that. Important thing is not only just to brush, how do you get a good access to the patient?
Yeah.
I did get a picture of knee to knee. That's how I do my exams with a patients less than age of 3. That's my husband right there.
Okay.
We took this picture early in the morning. So you hold one of you, if you have help, that's really good. If you can't do it every day, at least 3 times a week, you put the child's legs around your waist.
Okay.
The person who has it around the waist holds the arms, and then the other person, brushes the teeth. You will get a better access and better look at what you're doing.
Wow.
And also, if your child always fights you, which my son did till he was 2.5,
Right.
irrespective, like I said, every child fights.
Right.
brushing.
So don't be put off by that. It's common.
Believe me, I fought my child. I sat on him a couple of times, and I didn't have help because I'd rather brush his teeth than have him go through the
Right.
dental treatment. So
Right.
you're not the only ones out there
Okay.
who's having tough time. Every mom is having a tough time, and this is a very, very effective way to get it done.
Okay. Now, what about flossing? Because we've talked about brushing. My son loves to brush, and I think half of it is eating half the toothpaste, but which is kind of a problem. We have to make sure he only uses the proper amount of the toothpaste.
Yes, I was going to go there. I'm going to
Okay,
tell you the tips
okay,
for that.
all right.
About flossing, stick flossers. I have with my son and
Yes.
my patients. The little stick ones. I have seen they work better because the strings are long. Just to get,
that's
especially with
fine.
a special need, they have sensory issues. So if you get your hands in there,
Right.
they are not going to like it. So stick flossers, use them, and like I said, tell them in between there. I see Randy. I'm going to take it out.
Okay.
Very important.
So should the parent do the flossing in the beginning to get the child used to it if they're having a hard time?
like I said, till 3. You do all this stuff.
Okay, but what about even with a 10-year-old? If the 10-year-old's not really getting those
You go
areas.
after.
Okay.
Okay,
You go
they do
after.
it and then we go after.
Okay.
Now, this is a very important question that I want to bring up is which toothpaste to use?
Yeah.
Yes.
Okay? Because a lot of kids with special needs do not like the taste and they swallow the toothpaste, okay? Remember, the mechanical action of brushing teeth is great, so don't make toothbrush an issue. Of course, the fluoride in it helps, but
Okay.
mechanical action is more important than anything else other than for brushing and flossing.
Okay.
So I get a lot of parents, oh, he doesn't like the toothpaste. Don't worry about it. Toothpaste is not so important. Safe to swallow till they are 3, okay? Till they are 3, use safe to swallow because they're going to eat it.
Right.
There are a lot of toothpaste out there that you can use and, try different ones till you
And
find the right.
fluoride is important.
I do fluoride every 6 months at my office.
Okay.
But when they're less than 3, personally, I choose not them
To put the
swallow
fluoride, because they swallow it.
They swallow
Okay.
it, less than 3.
Okay.
And then, choose the right taste for your patient.
Okay.
Get different ones, different
Okay.
brands, till you have the right one.
We're pretty much out of time, unfortunately, and I know we wanted to briefly mention, because I want people to be able to hear from you, that the idea of having a bottle when children,
Yes.
Yeah,
I know you,
and we've
that was
got a
very
couple of
important.
pictures that I think we should show.
So I've been working with kids, and every day I see kids that have extensive treatment around from age of 2 to 5. It's called nursing bottle syndrome.
Okay.
Nursing bottle syndrome, what happens is if your child after once, you're supposed to be brushing teeth and not wake up in the middle of the night to feed them.
Yes.
However, if you continue to feed them, they'll fall asleep, they'll keep that last amount of milk in their mouth.
Yes.
And that rots their teeth.
Okay.
Okay, and we have, look at this.
Yes,
Look
that
at this.
is-
That child was how old?
5 years.
So that's not even putting them to bed with a bottle. That's not brushing that's giving them something to drink and sending them to bed without brushing teeth.
No, one is with sending them
There's
to bed.
another one.
Yeah, that's
Okay.
a 17-month
Okay.
or less than 2. No, one thing is sending them to bed without brushing their teeth and falling. The most important thing is all through the night. Sometimes kids wake up, breastfeed, sleep,
Okay.
wake up, breastfeed, sleep. So if they are, a bottle. I'm not against breastfeeding.
Right.
I
Okay.
love
Yes.
breastfeeding. for
Breastfeeding
kids.
or a bottle, but they're keeping the milk in the mouth
That
all
is the
night.
point I want to make
Okay.
here.
Okay,
So
great.
very important that after first birthday you start teaching them to drink with a straw. And if you get them to brush their teeth and sleep, wake up in the morning. Very hard to do that. If you're not able to do that, you're still breastfeeding or giving the bottle. Keep a bottle filled with water by your side. When you're done breastfeeding or with the bottle, stick the bottle in their mouth with
So they
water.
rinse it.
So it washes. They'll suck on it. The last part in their mouth will be water.
Okay.
Save your
very
child.
All right.
Nobody wants to go through such an extensive
Okay.
treatment.
No.
Really?
Okay, thank you, Dr. Shah.
Thank you so much.
You've
And
been-
And juice. Can I say one more
Yeah,
thing?
Yes,
juice.
yes.
Please do not give them a lot of juice. 4 ounces of juice a day, one time with a meal. Rest of the day, water.
Okay.
And milk with the meals. Juice, if you go to park, fill or outside or have a sippy cup filled with juice or bottle filled with juice all day long, they're sucking, it will give them nursing bottle syndrome.
Okay. Very important to know. We thank you so much.
You're
I
welcome.
learned a lot, and remember, we have a lot of copies here of Sam and the Sugar Bug. So if you'd like to have a copy for your child, a hard copy, autographed by Dr. Shah, we'll be happy to send it to you.